We are very appreciative of our longstanding collaboration with Dementia Care Aware and the team, and we appreciate this opportunity to talk to you about emergency preparedness for families living with dementia and their family caregivers, and really putting a spotlight on the experience we had in Los Angeles with our recent wildfires. My colleague, Anna Flores, and I work for Alzheimer's Los Angeles. We are a community-based organization that has been serving the ethnically, racially, and linguistically diverse communities of greater Los Angeles for more than 40 years. And our mission is to support families affected by Alzheimer's and dementia. That also includes, of course, when something unexpected happens, like an emergency. Fun fact, about 20 years ago, I was actually working for the health department in Puerto Rico, where I was overseeing professional training programs in emergency preparedness. So this topic is near and dear to my heart, and I would never have expected decades later that I would be at the intersection of emergency preparedness and Alzheimer's dementia care. So with that, let's set the stage a little bit for what we're going to be talking about. Next slide. I'm sure that most of you, as we were seeing the headlines or watching the news about the wildfires that started throughout Los Angeles County. So let's talk a little bit about what happened. And this is far from being all-encompassing. There were so many things that were transpiring. But hopefully this will let us level set and kind of have a glimpse or a snapshot of some of the key moments. So on January 7th in the morning, there was a plume of smoke over Malibu or the Pacific Palisades. And there were about 10 acres that were burning at that time. Within about a half hour or so, there was gridlock on Sunset Boulevard. If any of you are from Los Angeles or have traveled to Los Angeles, this is a major thoroughfare throughout our city. And in that short amount of time, there were about 200 acres burning. A few hours later, we're seeing evacuations, houses burning. The winds were crazy what was going on, and there were thousands of acres burning at that time. By that same evening, the Eaton fire broke out. And in a different area of Los Angeles County, this is the Altadena area, there were evacuations. People were leaving by foot, by car. It was hard for people to breathe, to see, to mobilize. And by that night, even later, about 10:30 p.m., the Hearst fire broke out in Sylmar. Next slide. By the next day, we already saw houses, schools, nursing homes had been destroyed. We had been hearing about lives lost. Evacuations were going on throughout the county. There were red flag warnings, power outages, air quality issues, the winds. People were getting advisories about not drinking the water. In the Eaton fire, over the first 2 days alone, emergency crews had evacuated at least 1,400 residents from dozens of nursing homes and assisted living facilities in that Altadena/Pasadena area alone. It was staggering, to say the least, what was going on during this time. Next slide. And if we fast forward just a couple weeks, we see just these are 2 out of about 9 fires throughout the city. How many acres had burned? What percentage had been contained? At one point, there were 200,000 people under evacuation orders in LA County. It felt like our city was on fire. And in fact, that is the case throughout much of LA City and also the county of Los Angeles. Next slide. This was a picture that I took from the front yard of the home that I had to evacuate from. It was hard to judge how close or how far away this was. But when I went outside, my question was, are we going to have to evacuate now from the house that we just evacuated from? How many evacuations are we going to have to do? When is the power going to go off in this neighborhood? At this point, no one was going outside. Everyone was wearing masks again if we had to be outside. So this was affecting really everyone in real time. And some of us were watching it on the news. Some of us didn't have power and we couldn't watch it on the news. And we were just trying to keep our phones charged so that we could do the basics of what we needed to do at this time. So let's go to the next slide and talk really about dementia, specifically in emergency situations. Next. So I think what's really important and what we're going to really be putting a spotlight on today is vulnerable populations. One measure of the strength of a community's response and recovery system is its attentiveness to its most vulnerable citizens. These are children, the frail elderly, the disabled, the impoverished, the disenfranchised. And as it says here, it's a cruel fact, disasters discriminate. So we know that when there is a disaster, all folks are affected, but it is felt differently in different communities, and certain communities are affected and impacted in different ways. Next slide. People 60 and older are almost 4 times as likely to die in extreme weather events as those who are younger. And we really need to ask ourselves, why is that the case? Next slide. An analysis by the Los Angeles Times, our local newspaper, found that the median age of those killed in the LA wildfires was 77. And at least 1 out of 3 deaths were among those with impairments that could affect mobility. And I want to just pause for a moment at the reality of the situation and the true impact on human lives. This picture here is a picture of one of the victims of the LA wildfires. This is a man who was unable to evacuate, who lost his life in the Eaton fire. So let's kind of start by talking about the challenges faced by older adults specifically. Next slide. We know that folks have chronic health conditions, and including respiratory conditions, and this impacts obviously susceptibility to smoke. Older adults may have mobility challenges that affect their ability to evacuate, for example. We know that when people have hearing and visual impairments, that affects the ability to prepare and respond accordingly in an emergency situation. Our older adults may be less likely to regularly check their cell phones. And I will say, I have the app on my phone for earthquake alerts. I don't know about my colleagues here who are based in California, but earthquakes we talk about a lot. That app I had ready on my phone. I did not have a wildfire alert app on my phone until I realized that the county was on fire and I needed to have one. So I quickly figured out how to download that app and get it on my phone. And I must have been on my phone around the clock during the days of this fire. And that was the experience for a lot of people. That is how we got the alerts and knew whether we were in a zone of evacuation warning or whether we actually needed to evacuate. But I had the luxury of having a smartphone, of knowing how to use it, of knowing how to get my apps, and again, regularly checking it. But that's not necessarily the case for everyone, including older adults. We also know that older adults may face social isolation, which makes things like being able to respond in a timely manner more challenging for people. And of course, people on fixed incomes make costs associated with things like evacuation, it magnifies that impact and may impact whether someone decides to evacuate and or when to do so. Next slide. And we also need to think about policies and systems specifically. It's more than just an individual's getting an alert on their phone or whether or not that individual makes a choice to evacuate and when they choose to do so. But our older adults and all of us, we live within policies and systems that affect our choices, affect our decision making, and affect how we live out our lives. So we know, and we need to think about registries of people with mobility challenges or other special needs who may need assistance. Did we have these systems in place? Did we have these registries? Requirements for pharmacists and pharmacies to issue a 30-day supply of medications ahead of a disaster. Is that something that's already in place? Are people with dementia, caregivers, and those with expertise in dementia involved in local preparedness efforts? Are emergency management agencies specifically focusing on people with Alzheimer's, people with dementia? Next slide. In Los Angeles's case, we didn't have the necessary systems in place for our most vulnerable members of our community. This was a headline that came out about April 2nd, so pretty recently, scrutinizing our county and some of the failures in coordinating evacuations, especially for people with disabilities and other mobility challenges, people who are elderly. Our Board of Supervisors just passed a motion to study a potential registry after the deaths of some older adults and kind of what that registry would look like and making sure we have things in place. But I have to say, in a lot of the articles that we're reading about the lack of systems and lack of policies for the elderly and disabled, I am always surprised that there's the absence of calling out specifically also people with Alzheimer's or related dementias, because there are some really unique considerations for our community members. Next slide. So with that context, I want to spotlight Alzheimer's and those with related dementias specifically. And we know that in California, the numbers of people with Alzheimer's is going up exponentially. According to the Los Angeles County Department of Public Health, currently it's estimated that there's about 190,300 residents of Los Angeles County who are age 65 and older living with Alzheimer's dementia. And we know that Alzheimer's dementia is terribly under-recognized and under-diagnosed. And so with that, as much as we do to put in place programs and registries and systems and policies for people with Alzheimer's dementia, if we don't even know that people have this disease, it's very hard to prepare them and their families for what may come. So let's think a little bit about what's unique about someone living with Alzheimer's or dementia. And of course, we know that everyone with this disease is different. So these are some generalizations that I'm making here. So we know that people with Alzheimer's dementia, depending on the impact of their cognition and the impact on their function, they may be unable to accurately answer questions. They may be more sensitive to noise and other stimuli in the environment. A new environment may be very disorienting or confusing to them. They may be more likely to roam or get lost or wander or explore an area that happens to be unfamiliar to them. They may be more likely to forget their mobility aids, medications, their phone. As the disease progresses, they may need someone with them 24/7 to stay safe. They may not understand instructions. They may have difficulty communicating or communicating their needs. Um, they may pick up on emotions, but have difficulty interpreting what's going on and what those things mean. And this leads to complex care for people and some really unique considerations for them. Next slide. So I'd like everyone to think about how an emergency may exacerbate these already existing factors in someone's life who has cognitive impairment, how an emergency situation may amplify these things or may complicate processes or systems or the need to evacuate, for example. So I'd like to ask everyone here today to think about, to imagine the experience of being in a shelter after evacuating from your home. Imagine that this person that we're looking at is a person with cognitive impairment. And this is a picture of the Pasadena Convention Center, the Red Cross Fire Shelter. I want you to think about the environmental stimuli in this evacuation shelter, the noises, the smells, being around strangers in an unfamiliar environment, the disruption to people's routines, the hundreds, the thousands of people in an evacuation site. And think about that person with cognitive impairment. Might this cause additional confusion or disorientation, perhaps agitation? Is there a quiet area this person can go to? Are there activities to keep this person busy? Are there comfort items available? Those questions almost sound ridiculous. We know that as we're setting up evacuation sites, no, there's probably not a quiet space, and there's probably not bags with activity items and comfort items. But given the situation, given the impairment to someone's cognition, let's think about what we have in place or did not have in place for people experiencing cognitive impairment. In the case of the Eaton fire, thousands, as I mentioned, thousands of nursing home and assisted living residents were evacuated to public evacuation shelters. Now, some of the plans that were in place were to evacuate people in an emergency to another skilled nursing facility or another assisted living. But when the entire community was affected by the fires, there was no way to get people to a neighboring facility. So instead, they went to public evacuation shelters, and they were ill-equipped. They were ill-equipped to take these people. They didn't have the supplies. They didn't have specialized medical attention. We had a colleague from USC Keck School of Medicine, a geriatrician, Dr. Laura Mosqueda, who showed up on her own to one of the shelters to lend a hand and see what she could do to help these folks. But these are people because they were coming from skilled nursing facilities and assisted living facilities. And we know that about 60% of people in our SNFs have cognitive impairment, have dementia. There's specific needs that they have that unfortunately our evacuation sites were unable to address. So let's talk about some of the actual personal experiences of some of the families. And my colleague Anne is as one of our care counselors. She is on the front lines working with families, and she's going to talk a bit about the experience of some of the families that we work with.
So this is a caregiver story of one of my clients, and this caregiver gave permission to use her story. And we ethical in our storytelling, so she definitely gave consent. And I want to share that Maria had always worked as a housekeeper, balancing her job, caring for her mother, Elena, who had dementia. But when the Palisade fires destroyed her neighborhood that she worked in, everything changed for her. The fire destroyed the home she worked at, leaving her without a job and forced her to focus entirely on her mother's care. And then also having to evacuate in the midst of all the crisis, which was really difficult. The dementia for Elena worsened. It made it hard for her to understand what was happening, why Maria was so urgent, and Maria having to manage the stress of preparing both herself and Elena to evacuate, and also trying to remain calm throughout this as well. It was very difficult. And Elena became has always been very dependent on all her activities of daily living and is used to having some form of routine. So with Maria's job now being gone, Maria became very overwhelmed and had to be at home becoming a full-time caregiver. And there was just a very hard emotional strain that took over Maria. It was very hard for her just dealing with that financial hardship and having to now attend to her mother's needs 24/7. It was very difficult during that time, but we were able to step in and help out and provide support in the sense of providing some form of respite care to allow her to take some form of breaks. And we were also able to provide support with groceries through a financial relief grant as well. And I just want to highlight that we had a lot of caregivers as well that lost their homes during this and had to relocate or were evacuated to a shelter. And it was just a very difficult time. And Elena's and Maria's story really highlights the multiple layers of trauma, I would say, such as having to evacuate, that caregiving trauma, Maria now having to focus continually on caring for her mom and being left without a job, that financial strain, and also social isolation. She wasn't able to get in contact right away with other friends and family. So it was just a very difficult time that our caregivers experience and their loved ones with dementia as well. Next slide, please. And I want to reiterate, right, during emergency situations, this can really trigger or worsen those dementia-related issues for our clients with dementia, such as wandering, right, due to feeling disoriented or experiencing that fight or flight response, feeling that they need to seek some form of familiarity, right? This can cause them or trigger them to want to wander. And also challenging behaviors. They may have impair other impairments. So then that impaired judgment can come into play, as well as the sensory overload of loud noises, flashing lights, just trying to make sense of what's happening. And then also caregiver stress. Maybe the caregiver is very worried and fears what's going to happen next. Where do I go? What's my plan? So just feeling very emotionally overwhelmed, maybe a physical strain as well, that they may be worried that they have to physically transfer or move their loved one with dementia as well. So just a lot of exacerbation, right, with these dementia related issues. And I think as professionals, we really just need to consider to be proactive and try to anticipate before disasters strike usually, so that way we can provide some form of immediate response and support to our clients.
So let's talk a bit about supporting families. And as Anna said, what our role is as professionals, whether we're working in healthcare or we're in community-based organizations, to really ensure that our families are well supported for emergency situations. And as I said before, for those of us in California, we talk a lot about preparedness, especially around earthquakes, but there are certainly other natural disasters that we need to be thinking about and making sure that our families are prepared for. Next slide. So preparedness is really the name of the game. We're going to talk about response as well, but when we prepare more for emergency situations, hopefully there's an impact on the level of our response efforts because families are more prepared for what they are going to face or what they may potentially face in an emergency. So it is important for us as professionals to think about whether we have talked to our families and our caregivers about their emergency plans. We know for our families affected by Alzheimer's and dementia, there is so much in our care planning efforts. As Anna said, we're talking about things like wandering. We're talking about challenging behaviors. We're looking at what we can do to ensure that our caregivers have the support that they need so that hopefully they can maintain home and community-based living for as long as possible. But have we talked about emergency preparedness as well? This is a topic that, doesn't always get elevated to the top of the list because there's so many other things that we are dealing with. But in a geographic area that we know has emergencies and natural disasters, and I will say with the wildfire experience, we had talked about wildfires. A lot of us, it was talk until it actually happened, right? And we said, wow, I actually do live in a fire zone. For the first time, I understand what those red flag warnings are actually about. And so talking to our families about what is the emergency plan? You have a flight of stairs in your home. How would that be navigated in an emergency? The evacuations, and as I said in the beginning, these fires spread so rapidly. From the time people got alerts to evacuate to actually evacuating, in some cases was minutes that they had to mobilize. So what is the plan in place? Are there things in our home that are going to facilitate evacuation or may hinder evacuation? We worked with families, they didn't know how to get their person they were caring for in their vehicle, along with their rollator or their walker, right? So their cars weren't even suited to evacuate. And in some communities, they couldn't even get their cars in and out. They literally evacuated on foot to be able to get out if they were lucky enough to be able to get out. So talking to families about what is the plan and how are we going to operationalize that plan if there is an emergency situation. Talking about emergencies makes people feel uncomfortable. We don't want to think about the worst case scenario. And in emergency planning, we plan for the worst and then we hope for the best. But we need to be elevating emergency preparedness. What do families have in place? Are there emergency kits in the home? And again, it's hard to talk about disaster-specific emergency planning, but we do know that different disasters may warrant different kinds of supplies or different kinds of plans too. Preparing families with something like go bags. So some of you may relate to this. When I had my children, I had a go bag. I called it a diaper bag, but it's essentially the same thing. And I would say for the first 3-4 years of my kid's life, I wouldn't have dreamed of leaving my home without that bag. In fact, I probably would have taken the bag even if I had forgotten my children when I left the home. There was no way I would leave my front door without that diaper bag or go bag. And what was in it? It was the essentials. Change of clothes, something to eat, something to drink, something to keep my kids entertained. And I sometimes regret that I still don't have a go bag, even though my kids are much older, because it's amazing how many times you say, gosh, I certainly wish I had that extra set of shoes, because they always manage to, find a puddle to splash in. But I'll say this, when I was a caregiver for a family member with dementia, I also had a go bag. I actually didn't really think of it as a go bag. It was just something that I had because it was a necessity. on a daily basis, not for an emergency. I never thought about an emergency. I just thought about when we have to go to a doctor's appointment. What do I take with me? If we happen to go to a restaurant or we're going to go do something, what do I need to have for those everyday needs? And these are these few extra items. They help with comfort, maybe distraction. My bag when I was a caregiver, I wouldn't have left the house without those catheters and a bottle of lubricant. Those were certainly in my go bag. Sanitizer, hand sanitizer was in there. I always had a change of clothes. I had a few family pictures. I had some music, a few distraction items, a couple snacks, maybe a bottle of water. And as I said, it really wasn't an emergency bag. It was just a bag that traveled with me because things come up. And the reason I frame it this way, and I think this is really important as professionals, and I'm going to say this a few times, is if we can elevate just regular care and quality care on a good day, we will also be helping with emergency preparedness efforts, right? We should be talking to our caregivers about how they can be more successful leaving the house with someone, not necessarily during an emergency, but just on an everyday basis. That helps our caregivers to be social. It helps them to be out in the community. But by having those conversations on a good day when there's not a disaster, we're also going to make sure that they have certain things in place that are going to be critical if there is a disaster as well. Safety planning is another one of these. Let's think about wandering. About 60% with Alzheimer's dementia, at some point during the course of the disease, the person will likely wander or get lost. 60%, which means that our care plans for people with Alzheimer's dementia need to consider wandering. Now, as Anna said, a disaster may only exacerbate the wandering, but if we have things in place already, at least we're heading off potentially some crises that could happen. We need to think about education on dementia-related behaviors and tools that people can use. We should think about training on emergency and disaster readiness. The Center for Caregiver Advancement has a training on emergency and disaster readiness for IHSS workers. Wouldn't it be great if they were already trained in this? And for my colleagues here who are in San Bernardino, hope you'll take advantage of that training opportunity for IHSS workers on emergency and disaster readiness. So there are some resources that are out there that should be part of our dementia-focused care plans anyway. In LA County, we have a program called LA Found. This is a county-wide initiative to help locate individuals with Alzheimer's, dementia, or autism who may wander. Again, wandering should always be part of our care plans for people with dementia because the risk of wandering is so high, and a disaster situation and like the evacuations that we had to experience in LA County only exacerbate the risk of wandering. But if someone is already part of a registry or already has a tracking device that is functional and being used, it's also going to be functional and used in the event of an emergency situation. Next slide. Are we supporting our caregivers with education around how to deal with things like anger, frustration, or fighting? Are we utilizing tip sheets and educational opportunities so our caregivers are better prepared to deal with dementia-related behaviors, irrespective of whether there's an emergency, but again, it will likely be exacerbated if there is an emergency situation. These are some tip sheets we have at Alzheimer's Los Angeles. They're available in multiple languages. They are written in plain language at about a 6th grade or lower literacy level on a number of topics, and you can certainly access them at no cost on our website. Next slide. I also encourage us to think about preparing. Let's elevate dementia in general and ensure some community activation around dementia education. And this is something that our professional communities can be part of too. We have an initiative in the state of California called Dementia Friends, but it's a global movement that is helping people get a little bit of education around dementia so that we can make a difference in the lives of people who are touched by dementia. Being a little bit more friendly, a little bit more cognizant, a little bit more sensitive to the needs of people with dementia. And trainings are offered for dementia friends. I've worked with healthcare systems that have said, you know what, we can't do intensive dementia training for everyone, but we could do a dementia friends training for all of our staff so that we know that there's a baseline of dementia kind of 101 for everyone in our community. So these are a few examples of some of the things we can do to prepare.
So response, right? With Alzheimer's Los Angeles, we definitely reached out right away to families to check in to see if they were affected, if they had any power outages, having to evacuate, their poor air quality, which many experienced. We, for days, we definitely were checking in to make sure that if there was any form of way that we can support, we definitely wanted to do that. And we made ourselves available to really check in and let our caregivers know that we wanted to be there to support them. So these are some ways that we were able to help caregivers during the emergency situations, such as providing emergency prepared resources, temporary respite care assistance, which really many benefited from to help manage any form of increased stress or disruption that was caused because of the evacuations. We also provided that emotional and psychological support, coordinating resources ongoingly. We with local agencies, help caregivers have access to shelter resources, food, medical care, and other essential services that they may have needed during that time. And we also were able to provide support through disaster relief grants, such as the respite that I mentioned. We also were able to provide education on managing the dementia related issues during the emergencies to help them maintain a care routine that hopefully wouldn't disrupt the person with dementia as much. And also, we always offer support through our helpline, and people can call between the hours of 9 and 4, Monday through Friday, and provide ongoing support that way as well. So this is an article that was written by the VP of Primary Care for Scan Health. And this article is a really good reminder that response is local. During the time of the LA wildfires, Gabriel Waterman, who is a primary care physician that oversees the home-based care for seniors in that local area by where the Eden fire occurred, most patients there are 80 and over, half of them have dementia. And it was just a very chaotic 3 days. And him and his team really went out of their way to try and locate their patients, mostly elderly with dementia that were evacuated from the assisted living facilities due to the fires, and just trying to provide support in any way that they could. They worked long hours trying to deliver medications, care, helping transfer patients to safer locations like the Pasadena Convention Center, which also was a reason that we were able to kind of step in and help coordinate. We did have a caregiver during that time that their the person that was helping had to leave shift, that they were off the clock, but the person with dementia still needed someone to be there with them. So we were trying to contact different respite agencies and trying to coordinate some form of support during that time. And thankfully, there was a volunteer that was able to step in. But overall, this article is a good reminder that, when something like this happens, sometimes response just needs to be local. Like in this case, his team was able to mobilize and call facilities members, the families, to try and really just provide support, whether it was having to write prescriptions or contacting other family, delivering those medications, attending to any form of care if they maybe got hurt or injured, and just making sure that they had what they needed water, masks, clothes, all those essential items that, as Jennifer was speaking, could be on like a to-go bag with them or something that they can really benefit from. So during wildfire emergencies, it's very important, I think, to just be able to respond some way, right? And in our line of field, caring for someone with dementia involves addressing several key needs, such as checking in on families. They may be displaced or not feeling safe, and just trying to provide that support by checking in. Also, maybe they need support with filling prescriptions. So just depending on the role, right? Just finding different ways to provide support. Maybe they need assistance with behaviors. The wildfires maybe trigger some form of other behavior that wasn't presenting before, and now they're wanting to wander off, or they're agitated, confused. Different ways that we can also support, such as making referrals. In some cases, some may need extra help with assisting with paperwork, right? If they, for a skilled nursing facility, just different ways that we can act in that moment. And I think it's a good way for us to provide support in managing that trauma that maybe the individual, the caregiver, and the person with dementia are experiencing during that time as well. Next slide. And this is just an overview of the resources that can provide key emergency preparedness for older adults and individuals with disabilities, such as the Administration for Community Living. They provide resources and toolkits for emergency preparedness. The Elder Locator for immediate support after an emergency. They can connect you with resources, including dementia-specific services. The American Red Cross, Safe and Well. This service helps individuals register their status during a disaster that would essentially allow or help loved ones know that you're safe, and also the disaster and emergency preparedness for older adults and individuals with disabilities. So the Department of Rehabilitation has a whole section online where they offer emergency preparedness guide, and they can help those with disabilities as well to plan during an emergency. And the FEMA text messages to find local shelters or disaster recovery centers as well. And these resources are essential for ensuring safety and well-being of our vulnerable populations.
And I want to actually say one additional comment about the resources, because these are tremendously beneficial resources that are available to people. But also, as Anna said, emergency response is local. So really understanding the local ecosystems that are available in our communities that mobilize during emergency situations is also critical. Now, we didn't put a slide here because obviously we're Los Angeles specific, and we know that there are people from different geographies, so local resources may not be relevant to everyone here on today's webinar. But when the wildfires happened, what we needed was to be able to share with families all of the local resources that were available. And knowing your community-based organizations, those are your boots on the ground. They know all the resources that are available and how their colleagues at another local community-based organization are mobilizing around an emergency and a response effort. So I can't tell you the number of emails that I saw coming through from our clinical director in this time, sharing, oh, this is what this agency next door is doing. If you have someone in this community, this is where they can go for supplies. This is where they can go, for some financial assistance. This organization locally is providing no interest loans. She was so wonderful in collecting that information and disseminating it so that we could connect people, because that's where you get your resources. We saw our community come together in unbelievable ways, but it's knowing what's available in your local community that is critical for people as well. So here, what I'd say are 3 takeaways. One is, if we elevate quality dementia care now and avoid crises now, your families will be better prepared for emergency situations. It's a win-win. So let's elevate dementia care. Let's make sure that we've addressed issues like wandering, some of those challenging behaviors, thinking about caregiver stress and fatigue, because it only gets worse in an emergency situation. Number 2, consider your role during an emergency. How can you, as a professional, kind of plug into that ecosystem of response and mobilization? How can you be a resource? How can you provide support? Can you be the physician that shows up somewhere? Can you be the community organizer that's getting clothing for people who've been evacuated? What's your role, and how can you plug in to that ecosystem that sometimes kind of organically develops as an emergency unfolds and we start seeing what the needs are going to be? And three, we all need to advocate for people with special needs, and probably more now than ever. Um, how can we think about people who have special needs, especially our families affected by Alzheimer's and dementia? We know how challenging things are for our families, and therefore, we are well positioned as professionals to be champions, to influence policies, to influence systems, and to elevate that this particular vulnerable population has unique considerations that we need to be thinking about ahead of the next disaster that inevitably will come. We put our contact information for our organization, but also if you want to reach out to either of us, please feel free to do so.
Unsurprisingly, we didn't get a lot of questions because I don't think anything was unclear really. And I do wonder if anybody's out in the audience who experienced some of this, or this is relevant to, their experiences in another disaster. I mean, we've had very similar things happening in Northern California as well. So not quite as one, not as recent, not quite as dramatic and enormous and ongoing. Some of the pictures and stories you shared really brought it back, and particularly the op-ed or article from Dr. Waterman about not being able to find his patients. I mean, I think we can all really relate to that. And it really sort of spotlights how, generally speaking, not proactive the system is at the moment. I'll leave up some information about our program, but I guess one question, I saw the resources that you had for clinicians, one theme for a lot of our programs is that we don't have a lot of time to, radically change practice, or do a lot of different things in visits now. But let's say we have somebody who either we suspect has dementia, we know has a functional impairment or mobility impairment, or actually has a dementia diagnosis. What is the one thing you would ask them to do in their next visit with that person around emergency preparedness, knowing that hopefully, we're not in an emergency at that time?
I'd say you have local Alzheimer's organizations that have the time and have the expertise. We will walk with families through this journey, so we can do some of the things that our clinicians can't do. We have the luxury of some of that time. We have the luxury, again, of that expertise in psychosocial educational support for families. Talk to your families about why it's important for them to have a conversation with a social worker at a local Alzheimer's organization that you trust, that you've worked with in the past, that you really think that it would be beneficial to them, and allow us to complement what you are doing in your practices. So know your organizations, know your local Alzheimer's organizations, and let's partner so that we can really make sure that families have all of their medical and their non-medical needs adequately met.
I think similar to what Jennifer said, I think definitely any form of Alzheimer's, I would say, organization that specializes, I think, because it's a little more unique, right? The behaviors, the different types of support that they may need. But I think it's a good way to just encourage them to just call, or just, have someone call with you if you can't call yourself, right? Or feel like, I don't think I need the help, but they probably do. But it's just that in taking that first initial step to call, and then it can open up a whole can of worms, right, of other supports that they may need as well. But I think it's a good start to just encourage that, look, there's these resources available when it comes to specifically more dementia related issues, and these are some resources that you can call. And if you want, I can call with you the first time, even taking that extra step to call with them, I think. Then after the first time, I think they feel a lot more comfortable expressing their concerns or the things they need help with.
Well, thank you. We're right at time. So I just want to thank everybody for their time for joining us today. Thank you for highlighting this issue, the resources out there, the amazing work you've done, the incredible stories. We hope this never happens again, but we will at least take away some learnings and some ways to improve everything that we do for people living with dementia. So thank you so much. Have a wonderful afternoon, everyone. And thank you, Jennifer and Anna, again.